This is a Dutch testing report tutorial. These tutorials are intended to be for education information. Please don't take them as medical advice. We want to help you kind of work through your results. The actual results we're showing here are not your results, but this discussion should be semi-specific to your particular situation. So there's a lot of data to work through on the cortisol. The primary data that we want to look at are first off, the free cortisol pattern. So measuring free cortisol at different times is important. We want to look at a waking sample, which tells you not the waking cortisol. A waking urine sample tells you the cortisol during the sleeping period. And then the first 2 hours of the day, we expect a big surge of cortisol, and then we expect it to come back down in the afternoon and at nighttime. So with respect to your results, you're going to want to look at those 4 time points compared to what's expected, and we're looking for dysfunction in that up and down pattern of cortisol. And we're also looking for the overall levels. So when we look at the overall levels of free cortisol, we're adding these 4 up. Now with this particular situation that we're looking at, there's a normal level of free cortisol, but on the lower side. Okay, so reasonable levels, and again, you're going to want to look at your actual pattern, the patient's actual pattern, to see about dysfunction in the actual pattern. Now that tells you free or circulating cortisol levels. It's not the best marker for overall production of cortisol because free cortisol is only about 1% of the total. That's why we also measure metabolized cortisol. That's the truer measurement of total cortisol production or glandular output, the adrenal glandular output of cortisol, because it represents about 75% of the total cortisol that's produced. Now in this particular case, it's low. Right, so even though the free cortisol is creeping up into the normal range, the metabolites are implying that the overall production of cortisol is on the lower side. So as we discuss further what's going on with the cortisol, let's talk just a little bit about how it's made. So the adrenal gland makes cortisol when the brain signals it with a hormone called ACTH. So when it's made, it then circulates as cortisol, but it can also circulate as cortisone. So in its free form, cortisol or cortisone circulate throughout the body, and it gets interconverted back and forth. The enzyme that does that is called 11-beta-HSD, and that's this action depicted by this double arrow here at the bottom. It's a back and forth between cortisol and cortisone. So because it goes back and forth so readily, it is of value to also look at the free cortisone pattern. So that can help confirm what's going on in these different time periods with the free hormone. It's of secondary importance to the free cortisol, but it's worth looking at to confirm a bit of that story. So if the free cortisol, as in this case, overall is low normal, and the total production is also low, it can help to look at that cortisone to confirm, what's going on a bit, so you'll want to evaluate that as well. But again, not as much importance put on that as these other measurements. The cortisol metabolism, we want to know the rate of metabolism. We're looking at potentially the relative levels between the total production and the free hormone. So in a situation like this, if the total metabolites, the total production is very, very low, it may imply that there may be a little bit of sluggish or slowed cortisol metabolism. Probably not to any extreme in a situation like this. Things that can affect cortisol clearance though, obesity, thyroid. So you can increase cortisol clearance with obesity, with increased thyroid, potentially long-term exposure to cortisol. On the other hand, you can slow that cortisol clearance down with low thyroid, low liver function, and when the free cortisol is normal and the total production is low, if anything, it may imply a little bit of lower cortisol clearance. The other thing we can see here, and the reason we want to look at cortisone as well, is we want to also ask the question of, is there a preference of heavily deactivating the cortisol to cortisone, or is there a preference of keeping that cortisol in its active form? Now, it's intuitive to ask that question by looking at the free cortisone and the free cortisol to see which one's higher. What the literature would suggest is that those free hormones only represent about 1% of the total. If you really want to know which one's predominating, look at the metabolites. So this index looks at the ratio of cortisol metabolites and cortisone metabolites. So if yours is pointed more towards cortisol, then your body's really hanging on to that free cortisol, and that may be why your free cortisol is normal overall, even though the production is relatively low. On the other hand, you may have a situation like this where the cortisol is readily deactivated, and that is not going to be overly helpful when there's low cortisol overall for it to be readily deactivated, and that's something that providers can work with. But it's important to know all of this information, the free cortisol at different time points during the day, the total of production, and then any metabolic preference that there may be in a particular situation. So you can learn more at DutchTest.com. If patients have questions, please do see your healthcare provider when you have questions about your particular case and your results and any particular treatments that may come from that. But we thank you for testing with us and look forward to continuing to work with you.